for money. After you've purchased the car, and if you drive the car for a long time, there's zero return on that investment other than you've had the car. So I was just saying, we have to line up what our expectations are and see if we're meeting those expectations. At this point, given the fact that we don't have a budget, we don't have a template, we don't have a plan from which to measure against to see if we are actually spending our money in a valuable manner. Thank you.
Déclaration des députés, statements by members. The honourable member will have 3 minutes of questions after oral questions. L'honorable député de...
The honourable member for Sudbury.
Merci, Madame la Présidente. Every casual hockey fan knows Willie Reed became the first black player in the National Hockey League when he played for the Boston Bruins in 1958. But how many can name the second black player in the NHL? Mike Marson was just 19 years old when he graduated from the Sudbury Wolves to the NHL in 1974. Marson was the first black player to be drafted into and play regularly in the NHL. Marson ended up playing 6 years for the Washington Capitals and Los Angeles Kings. Et pendant le mois de l'histoire des Noirs.
And during Black History Month, we should highlight the impact that black players have had on the sport. Marson's career helped pave the way for many other players of color.
Retired at the age of 25, still in his prime, but tired of fighting, and returned to Ontario to work. Madam Speaker, as we reflect on and celebrate Black History Month, I hope we can give thanks for the men and women who opened the door to inclusion and diversity in Canada's institutions. We all know the stories of Jackie Robinson and Willie O'Ree, but the men and women who came after them still had mountains to climb and often still do. That is why hockey in Canada are stronger when we all support diversity. Merci, Madame la Présidente.
The honourable member for Peat Meadows, Maple Ridge.
Madam Speaker, Bollywood is a big deal for film production in India and internationally. Maple Ridge's Dr. Biju Matthews' book on Anand Kumar and the Super 30 is the inspiration behind a blockbuster Bollywood film starring Hrithik Roshan. The film dramatizes how Anand pours out his life to give underprivileged children in the slums the opportunity to overcome all obstacles to attend India's top institutions. Dr. Matthews is also the founding president of Ridge Meadows South Asian Culture Society, or RIMSACS. RIMSACS organizes galas that showcase outstanding contributions by the South Asian immigrants to Canada. Dr. Matthew was also a catalyst in expanding psychiatric services in Ridge Meadows Hospital to 22 beds. Many thanks also to Ron Anlick for his $1 million contribution. In addition, Dr. Matthew has helped establish our local Youth Wellness Center, or the Foundry. This has been key to helping our youth who struggle with mental health and addictions challenges. Thank you, Bijou, for all that you've done and continue to do.
L'honorable député de Marc-Aurèle.
The honourable member for Marc-Aurèle-Fortin.
Madame la Présidente.
Madam Speaker, this week I'd like to talk about a company in my riding of Marc-Aurèle-Fortin, M1 Composites Technology, Inc. This company, which is based in Sainte-Rose, recently achieved a MAC 5 rating, which is the highest MAC rating possible. MAC is a methodological approach that was developed to improve the mastery of key business processes at suppliers in order to achieve excellence in terms of leadership, operational excellence, and excellence in workforce planning and development. M1 is only the second company to achieve a MAC 5 rating, and it's the first small Canadian business to do so. The honourable member from Berthier-Maskinongé. Madam Speaker, good news. For the first time in decades, Quebec has seen an increase in the number of farms in the province. Now, many small farms are becoming increasingly popular. Family farms, local agriculture, and on-farm processing are all factors that explain this increase. Now, food autonomy is on everyone's mind these days, and I'm very happy to see that Quebec's farms are well placed to meet the challenge. I would call upon the government to keep its promise and to compensate farmers for their losses under recent trade agreements, including the new NAFTA. All parties should support Bill C-216, as the UPA has asked them to do, so that the government will no longer be able to make any further concessions on supply management. Like the Bloc, they should show that they're proud of our farmers. Thank you.
Member for Glengarry, Prescott Russell.
Monsieur le Président, je me lève en
Mr. Speaker, I rise in the House to recognize the importance of our official language minority communities. In our first mandate, we increased funding for the OLMC Action Plan after a 10-year budget freeze. We restored the Court Challenges Program, and we appointed bilingual judges, something that the leader of the Conservative Party completely omitted from his letter last week. In 2019, we promised the enumeration of rights holders. Promise kept. Last Friday, the minister tabled a white book concerning her vision for the modernization of the Official Languages Act. For example, we're going to enshrine the practice of appointing bilingual judges, entrust the act to a central government organization, and strengthen the power of the commissioner. On the question of official languages, we have a caucus, a minister, and a prime minister who are here to listen to our official language minority communities and who are delivering on their promises.
Honourable Member for Elgin, Middlesex, London.
Speaker, February is Heart Month. Earlier this month, we celebrated Congenital Heart Awareness Week. There is no known cause or cure for congenital heart disease or congenital heart defects. This condition exists from birth and can change the way blood flows through the heart. CHD can lead to irregular heartbeats, strokes, and even heart failure. 1 in 100 babies are born with some form of congenital heart disease, and it impacts the lives of nearly 260,000 Canadians today. It is the #1 birth defect in Canadians. While most Canadians born with CHD lead long and successful lives, many must undergo surgeries or have a lifelong cardiac care. I would like to thank my constituent, Alan Weatherall, and his work with the Canadian Congenital Heart Alliance. The Alliance is dedicated to raising awareness of congenital heart defects while providing peer support, mentoring, and outreach programs to patients and families. This exemplary work should encourage all, constituents and colleagues alike, to have a heart and recognize February as Heart Month. Thank you, Mr. Speaker.
The Honourable Member for Mississauga, Erin Mills.
Mr. Speaker, the COVID-19 pandemic has put a strain on food banks across Canada, but that did not stop them from keeping their doors open and working tirelessly to serve the most vulnerable of Canadians. Today, I want to recognize Eden Food for Change, a remarkable food bank in my riding of Mississauga, Erin Mills, that has been serving the needs of vulnerable residents for the past 30 years. Over this weekend, Eden Food for Change hosted their annual Coldest Night of the Year walk against hunger and homelessness in a virtual and COVID-friendly manner. The goal of this event was to raise money for charities serving Canadians facing homelessness and hunger. This year, 188 walkers took part in this event, raising over $73,000. Thank you to the incredible staff, volunteers, participants who made this initiative happen. You are saving lives each and every day. Thank you, Mr. Speaker.
The Honourable Member for Cape Breton, Cancel.
Mr. Speaker, it is with great sadness that I speak in the House today in the memory of a Glace Bay icon, Kay McGuinness. Kay passed away on February 1st, leaving behind a legacy of strength, passion, and resilience. Kay worked as a nurse at the Glace Bay General Hospital for over 35 years. As a nurse, Kay went above and beyond to help her patients. She never put herself first at any time, and helping others was something that brought her great joy throughout her remarkable nursing career and beyond. I have no doubt that Kay will be remembered amongst many in the community of Glace Bay for her benevolent service as a dedicated nurse, community leader, and countless charitable actions. Mr. Speaker, on behalf of Cape Breton Council constituents and members of this House, I wish to offer my sincere condolences to Kay's family and her loved ones. She was an inspiration to all and will be deeply missed.
The Honourable Member for Edmonton West.
Thank you, Mr. Speaker. Kaysen and Harper are toddlers living in my riding and the neighbouring riding. Both suffer from spinal muscular atrophy, a rare disease that usually ends a life by age 2. But Novartis has created a miracle drug, Zolgensma. One shot stops the disease dead in its tracks. The problem, it's a brand new drug and it's $3 million of treatment, and the governments weren't covering it. Both families started fundraising. Ryan Reynolds, aka Deadpool, even donated, but $3 million is a lot of money. An angel donor stepped in to donate the money for Harper, and the Novartis came in and said they would cover the cost for Harper as well. So Harper's families took the money, passed on to Kason's family, said he would be covered as well. 6 months later, both toddlers are doing great. So I want to thank Ryan Reynolds, all the donators, Novartis, and especially the angel donor who helped save their lives. Thank you very much, and God bless you all.
The honourable member for Mount Royal.
Mr. Speaker, I am pleased to recognize International Mother Language Day, an annual observance led by the Bangladeshi diaspora in Canada and across the world, which is held on February 21st. The day's goal is to promote respect for linguistic and cultural diversity and exists because of the fight for the respect of the Bengali language when Bangladesh formed one country with Pakistan. International Mother Language Day has been recognized by UNESCO and has been enshrined by 2 United Nations General Assembly resolutions. No day is more important to persons of Bangladeshi origin or heritage, and I fully support its intended goal of promoting the preservation and protection of all languages. Allow me to congratulate Montreal City Councillor Marvin Rotrand and Suhel Mia, Tufik Azaz Akhtar, and Deepak Dar, whose organizations are active in my riding and champion this day. I invite all my colleagues to join me in celebrating alongside Bangladeshi Canadians across our country. Thank you, Mr. Speaker.
The honourable member for Calgary Skyview.
Mr. Speaker, I'm pleased to rise today to mark Canada's first National Human Trafficking Awareness Day. Human trafficking is not something Canadians think of often, if at all. And when we do, we often think this horrendous and dehumanizing crime is being committed elsewhere in the world. However, Mr. Speaker, human trafficking happens right here in our own backyards. 1 in 3 victims of human trafficking are trafficked by an intimate partner, and this crime is quickly becoming the most lucrative crime in Canada. This is why it is important for us to raise awareness, to let Canadians know that human trafficking does exist here in Canada, to recognize the signs of a person being trafficked, and to report it to the local law enforcement. Mr. Speaker, I encourage all members of this House and Canadians to visit the government's website to learn more about human trafficking and to help put a stop to this disturbing and dehumanizing crime. Thank you, Mr. Speaker.
The honourable member for Chicoutimi-Le-Fjord. Mr. Speaker, instead of focusing on the pandemic and vaccinating Canadians, last week the Liberals tabled Bill C-21, which would harm honest, law-abiding gun owners. Worse, they also tabled a bill to reduce prison sentences for criminals who had illegal arms. This is typical Liberal action. Honest citizens are punished while criminals are given a break. The government should invest in fighting gangs so that we can give police the tools that they need to stop illegal arms trade and get dangerous criminals off our streets, instead of targeting our hunters and recreational gun owners, as well as airsoft and paintball practitioners. Conservatives will always support reasonable gun measures to protect our families and to keep guns out of the hands of criminals.
The honourable member for Vancouver Kingsway.
It is in times of crisis that we see the very best in Canadians. I rise today to pay tribute to the everyday heroes who are doing so much to support the people of Vancouver Kingsway. From the frontline health workers at Evergreen and Luma Community Medical Centres to the staff at Collingwood and Cedar Cottage neighborhood houses. From the first responders at fire halls 13, 15, and 20 to the paramedics serving Station 245. From the teachers and support staff at every school in the riding to the hospital workers at St. Joseph's and Children's and Women's. We are deeply grateful for the skill and sacrifice of those who serve, protect, and nurture. I especially want to thank all of the small businesses in our community. These are the enterprises that employ our neighbors and provide the goods and services we need to survive and prosper. I know many are hurting and ask this government to remember them and provide help in the upcoming budget. To all, your courage, commitment, and generosity will never be forgotten.
The honourable member for Thérèse de Blainville. Mr. Speaker, It's now been a year since this House passed a motion calling on the government. Mr. Speaker, it's now been a year since this House passed a motion calling on the government to increase employment insurance special sickness benefits from 15 to 50 weeks. Currently, people with cancer or with a chronic illness, people who have paid into employment insurance their entire lives, are being abandoned. They have to worry not only about fighting their illness, but also about making ends meet at the end of the month. People who should be dedicating their energy to getting better are instead having to stress over their financial situation, and that's unacceptable. Mr. Speaker, the Bloc Québécois has tabled a bill to fix this situation. We call upon the government to increase employment insurance benefits from 15 to 50 weeks immediately.
The Honourable Member for Battleford's Lloydminster.
Mr. Speaker, Canadians are resilient, and they have sacrificed so much over this past year. But they need to know that their government is focused on securing their future. Unfortunately, this Prime Minister has repeatedly let them down during this crisis. This government has been consistently slow to respond and prioritized ideology over Canadian families. The Prime Minister and his government can't keep asking for families to stay disconnected and for seniors to isolate. They can't keep sacrificing jobs, ignoring sectors of the economy, and avoiding transparency. Mr. Speaker, they need to do better. They need to get the vaccine rollout right to secure jobs and secure our future. And if they can't, Mr. Speaker, they can get out of the way, because every Canadian, regardless of their age, where they live, or what sector of the economy they work in, needs a government that has their back.
The Honourable Member for Cumberland Colchester.
Thank you, Mr. Speaker. One day at a time is a life-saving mantra for millions, including the families of children living with a life-threatening illness. Our commitments to introduce the first rare disease strategy and national pharmacare will enable all Canadians to access vital medication. And since cancer remains the main cause of death by disease for Canadian children, our commitment of $30 million to childhood cancer research has been endorsed by children's hospitals, cancer organizations, and over 150 families experiencing this devastating diagnosis. Today, I would like to add my family's name to that list in honor of our own young warrior, Maya Zan Rowland, battling osteosarcoma with grit, grace, and giver. Budget 2021 is the first opportunity our government has to keep our commitments to sick kids. There's no time to waste. Just ask Maya. When you're 17 and living with cancer, every day is a gift. Thank you.
Question orale, oral questions. The Honourable Member for Portage-Lisgar.
For the next few months, we're not going to have a lot of people vaccinated. That's a fact. Who said that, Mr. Speaker? Dr. Tam said it last Friday. That's because even if the Prime Minister's projections for April are reached, we'll only have 8% of Canadians vaccinated. Public health officers across the country are warning about a third wave, and new variants pose a new threat. Why has the Prime Minister's massive vaccine failure left Canadians so vulnerable to continued lockdowns and a third wave of COVID-19?
The Honourable Minister.
Mr. Speaker, I thank the Honourable Member for the question. In fact, our vaccine procurement strategy is on track for the delivery of 6 million vaccines prior to the end of March, a cumulative total of 29 million prior to the end of June, and 84 million vaccines prior to the end of September of approved suppliers alone. We may have additional vaccines coming online, Mr. Speaker, and all Canadians who wish to be vaccinated prior to the end of September will have access to a vaccine. Thank you, Mr. Speaker.
The Honourable Member for Portage-Lisgar.
Well, Mr. Speaker, we're receiving 82,000 fewer doses of Moderna than we expected to get this week. That is not a victory. That's 41,000 more Canadians who will be stuck waiting for a vaccine because of the Prime Minister's failure to make smart decisions early on when it came to the vaccine. They need to vaccinate 300,000 Canadians a day in order to meet this September deadline. Now, as we speak, the U.S. is vaccinating 1.7 million people per day, so we know it can be done. So where's their plan that doesn't change by the moment that will get 300,000 Canadians vaccinated each and every day?
Honourable Minister.
Mr. Speaker, this plan does not change by the moment. This plan has been in place for many months. And Mr. Speaker, I'm happy to announce to this House of Commons today that we will be receiving 500,000 plus vaccines in this country just this week alone, Mr. Speaker. We are on a very steep ramp up towards millions and millions of vaccines coming into this country, Mr. Speaker. And I hope that all Canadians, including all members of this House, will work together to make sure that we're executing a Team Canada approach. Thank you, Mr. Speaker.
The Honourable Member for Portage-Lisker.
Well, Mr. Speaker, we really hope that that happens because as of this morning, Canada is 59th in the world in vaccine administration per capita. The United States has inoculated 63 million people, the UK 18 million, and Israel has 83% of their population vaccinated. While this government has a measly target that's only going to see 8% of Canadians vaccinated by April. If 8% and 59th isn't good enough for the Israelis, the Brits, or the Americans, why in the world does this Prime Minister think that it's good enough for Canadians?
Honourable Minister.
Mr. Speaker, I do appreciate the question coming from the Honourable Member. And I will mention again, Mr. Speaker, that we have a plan and we are executing that plan. 6 million prior to the end of March, 29 million prior to the end of June, and 84 million vaccines of approved suppliers alone prior to the end of September. And as I said, Mr. Speaker, additional vaccines, AstraZeneca, J&J, Novavax, may come online during this time with approval from Health Canada, and that will mean additional vaccines into this country. Thank you so much, Mr. Speaker.
Honorable député de Louis.
The Honourable Member for Louis Saint Laurent. Mr. Speaker, since 2014, the Uyghur Muslim minority in northwest China has been experiencing unspeakable torment. 2 million people have disappeared. Women have been raped and sterilized. A score of religious sites have been destroyed. For me, it's clear this is a genocide. In less than an hour, there will be a vote in this House on the question. Will this Prime Minister show the courage to act as a leader, take a position, and vote on this issue? The Honourable Minister. Thank you, Mr. Speaker. As we have said on multiple occasions, we are seriously concerned about the allegations and reports about the treatment of Uyghur Muslims and other minorities, other Turkic Muslim minorities in the Xinjiang region. We have clearly stated this to the government of China. And we have requested access to the region so that experts can investigate the situation. We take genocide allegations very seriously, and we are working closely with our international partners on this extremely important issue. The Honourable
Missing in action again.
The Honourable Member.
Monsieur le Président, sur cet enjeu très crucial,
Mr. Speaker, on this critical issue, we can't speak only about allegations. We need to take a clear stand. The U.S. has done so. 2 key figures in the Biden administration have already spoken about a genocide. Once again, Mr. Speaker, in less than an hour there will be a vote on this. Will our Prime Minister, who is supposed to represent all Canadians, take a stand and denounce this genocide? The Honourable Minister. Thank you very much, Mr. Speaker. This is essentially the same question once again. We have clearly stated to the government of China what our position is on these reports and allegations, which are highly concerning. Regarding the treatment of Uyghur Muslims and other minorities in the Xinjiang region, we have also brought in measures regarding products produced in the labor camps, The Government of Canada takes these allegations very seriously, and we will continue to work with our international partners on this file. The Honourable Member for La Prairie. Mr. Speaker, we all know that the best way to avoid having issues when you get back from a trip is to simply not travel. But this government's hotel quarantines program sets a new standard for incompetence. It's basically like they reinvented the Phoenix system, Mr. Speaker. People call the government's hotline and are told they'll have to wait 3 hours. They wait, and after 3 hours, the line is dropped. Some people have had to wait up to 25 hours to reserve a room. We're talking about a hotline, Mr. Speaker. What is the government doing here? The Honourable Minister.
Every step of the way, we have protected Canadians from the importation of COVID-19 at the borders. Adding the additional layer of testing at the borders with the quarantine while we receive the results of those tests is an additional step to understand the role of variants of concern and how the virus is shifting and changing and how it will impact our success. I want to thank Canadians for their continued hard work and remind Canadians that now is not the time to travel internationally.
The Honourable Member for La Prairie. Mr. Speaker, since mid-December, we've known that there is a British variant of COVID. There were two ways to prevent that variant from spreading in Quebec. One, quickly vaccinate the population. That's a failure. Or to implement mandatory quarantines for travelers. That took 2 months. And what we have now is a comedy of errors. The result of this is that the British variant is now in our schools, in our primary schools in Quebec. All we can hope now is that the lockdown measures will work. Does this government realize that it is people in lockdown who are paying the price for its errors? The Honourable Minister.
Mr. Speaker, every step of the way, we have been monitoring this virus as it changes and taking appropriate steps as necessary on the border to strengthen our processes. I will remind the member that we have had a mandatory 14-day quarantine for quite some time now. And in fact, we want to thank provinces and territories for the hard work they have been taking with us to ensure the enforcement of that quarantine. Now, Mr. Speaker, there's more that we can do. We know that fighting COVID-19 is an all-hands-on-deck endeavor, and we will continue to be there for provinces and territories as they fight COVID-19, including by providing tools like vaccination.
Honourable Member for North Island Powell River.
Mr. Speaker, the Prime Minister talks a lot about how this government's relationship with Indigenous peoples is the most important one. They talk about it during elections. They talk about it after they're elected. And they talked about it when they introduced legislation on UNDRIP, Bill C-15. But, Mr. Speaker, that bill was introduced 3 months ago, and we've only had 2 hours of debate, with no further debate scheduled. What's going on? It's almost like the Liberals don't want this bill to pass. If this relationship is really the government's most important one, when will they stop taking words and get to work proving it?
Honourable Minister.
Mr. Speaker, our government remains firmly committed to implementing Bill C-15, which will ensure that Indigenous rights are considered in reviewing and updating federal laws that affect those rights. At core, Mr. Speaker, this is a human rights issue. It's about protecting the rights to self-determination, self-government, equality, and non-discrimination. Mr. Speaker, this bill is a major step forward. In our reconciliation journey, we support it wholeheartedly. It remains one of our top priorities, and we will see this through.
The Honourable Member for Timmins, James Bay.
Mr. Speaker, a damning media investigation has revealed that this government consistently green lights water projects on First Nation reserves to companies with bad track records, and that the minister's insistence on the lowest bid has resulted in cost overruns, corners being cut, and the ongoing denial of safe service. And yet the minister continues to stick to his 3-point plan, which is, number 1, show concern. Number 2, act surprised. And number 3, do nothing. Why is he continuing to perpetuate this policy of incompetence, negligence, and the basic denial of human rights to First Nation people across this country?
Honourable Minister.
Well, thank you, Mr. Speaker. And as the member will well note, at the end of November and the beginning of December, this government invested $1.5 billion to further invest in water infrastructure with First Nations and in partnership with First Nations. The member is fundamentally mistaken with the process, about the process with which he engaged with First Nations. They pick the contractors, we work with them, and we follow industry practice to ensure that these projects will move forward, and that ultimately long-term water advisories get lifted. This is a choice of the First Nation, and we will continue to walk that path with them as we ensure that the long-term asset, the water infrastructure, is preserved in partnership with First Nations.
The honourable member for Carleton.
To be the worst at one thing is a real distinction. To be the worst at everything takes real talent and effort. Unemployment in Canada, with 800,000 people losing their jobs, is the highest in the G7, the worst. Our vaccine results here in Canada are the worst in the G7. And they paid for all that failure with the biggest deficit, the worst fiscal record in the G7. Can the Prime Minister explain to us how he's managed to deliver the worst results at the highest price?
The Honourable Minister.
Mr. Speaker, to the contrary, I will point out that Canada has had fewer people die than many of the comparator countries that the honourable member points to. Moreover, he's using mistaken statistics in order to try to trick Canadians into supporting them. If you actually want to compare the employment record of Canada against the U.S., 71% of the jobs lost during the pandemic in Canada have returned to 56% in the U.S. We have a higher labour force participation rate than our G7 counterparts. Mr. Speaker, we have had one of the most ambitious economic recovery strategies and pandemic response strategies, and if the honourable member wants to continue to try to trick Canadians into supporting them, I invite him to remain on the opposition side of the aisle after the next election.
The honourable member for Carleton.
Well, let me quote what the BMO says about Canada's U.S. comparison. The unemployment rate in Canada was 3.1 percentage points higher than the U.S. in January. This compares with a 2% spread over the last 5 years. We estimate that Canadian unemployment could be roughly 300,000 jobs below where it would otherwise be if GDP was keeping pace with the U.S. economy. So stop torturing the data to make it to confess to anything and tell the truth. Doesn't Canada have the highest unemployment in the G7 today? Yes or no?
The Honourable Minister.
Mr. Speaker, I've watched the honourable member try to use the same statistics to trick Canadians for the last number of weeks. The unemployment data kept in Canada measures something different than the federal labour of statistics in the United States. If you want to compare apples to apples, I would point him to the labour force participation. In Canada, it is 64.3%, Japan 62%, the US 61.3%, and Germany 56.1%. If he's wondering how our pandemic response is assisted in this, I point him to the fact that 71% of the jobs lost during the pandemic in Canada have returned to 56% in the United States.
Honourable member for Abbotsford.
Well, Mr. Speaker, it's been over 700 days since the Prime Minister last tabled a budget for Canadians to see. That's unprecedented. The most important planning document for a federal government is a budget. Yet for 2 years, the government has operated with little transparency and even less accountability. Meanwhile, the Prime Minister has botched its vaccine rollout, and he's failed to deliver a robust economic plan for the future. Where's the transparency, and when will the Prime Minister finally table a budget for Canadians to see?
Honourable Minister. The Honourable Minister.
Mr. Speaker, look, I thank the honourable member for the question, and I'd like to correct the record. He may be aware that there has been a global pandemic that took place during the past year that has interfered with the way that we ordinarily do things when it comes to our budgetary practices. If he's interested in transparency, I would remind him during the heart of the pandemic a little less than a year ago, when we were launching unprecedented strategies to get money to Canadians in need, we actually showed up repeatedly. In fact, every 2 weeks with a new report to the Finance Committee. I happen to know this because I was a witness on one occasion that actually presented that data to the committee. Every step of the way, we have advanced measures to help Canadians keep food on the table, a roof over their heads, and help.
The honourable member for Abbotsford.
Well, Mr. Speaker, you cannot blame the pandemic for not having an economic plan. The minister is asking Canadians for the right to borrow and spend billions of dollars more without a plan. Thousands of Canadians and small businesses are falling through the cracks because of the Prime Minister's failure to deliver a proper plan to reopen our economy. Canadians want their jobs back. They want their small businesses back. They want their lives back. They want their communities back. What's the Prime Minister's plan? And when will she, the Minister, table a budget to show all Canadians what her plan for the future is?
Honourable Minister.
Mr. Speaker, we have been transparent about our plan from the beginning. Our plan has been to respond in an unprecedented and ambitious way to ensure that Canadians had the support they need to see them through this pandemic so they can help contribute to the economic recovery when it is safe to do so. If he's curious about how our plan has panned out, I would point him to the nearly 9 million Canadians who benefited from CERB. I would point him to the 4.5 million Canadians who were kept on the payroll because of the wage subsidy. I would point him to the nearly 1 million businesses that have been able to keep the lights on because of emergency support we've gotten to them in their time of need. Our plan has been to support Canadians, to keep them breathing.
L'honorable député de Charlesbourg.
The honourable member for Charlesbourg Haute-Saint-Charles. Mr. Speaker, this government keeps saying the same thing over and over, and we'll probably be hearing them boast again about the number of doses we'll be receiving this week. But the amount we're going to receive is actually less than the number of people vaccinated every day in some countries. Canada is now 58th in terms of the total number of vaccines administered, and only 8% of the population, only 8% will be vaccinated by the end of March. Can the Prime Minister explain why Canada is the only G7 country to experience these kinds of delays? The Honourable Minister.
Oh, thank you, Mr. Speaker. I just want to reiterate that Canada was one of the first countries to begin inoculations, one of the first countries to sign with Pfizer and Moderna, and that in this week alone, we will be receiving well over 500,000 doses at 683,000. And this is the beginning of a continued steep ramp up with over 400,000 doses arriving per week prior to the end of March, and then millions and millions of doses arriving in Q2, Mr. Speaker. That's our plan. It's been our plan for months, and we will make sure that all Canadians who wish to have access to a vaccine prior to the end of September will indeed have such access. Thank you so much, Mr. Speaker.
L'honorable député de Charlesbourg.
The honourable member for Charlesbourg Haute-Saint-Charles. Mr. Speaker, we know that that's the plan, and the plan is that only 8% of Canadians will be vaccinated by the end of March. Now, the other issue is travellers. Travellers coming back to Canada are waiting up to 30 hours to try to reserve a hotel quarantine room. And they can't get through to anyone. It's a total mess. This Prime Minister dragged his feet on negotiating vaccine purchases, securing the borders, and now he is introducing measures for travellers that simply don't work. Can the Prime Minister tell us when he plans to fix this hotel problem?
Honorable Ministre.
Monsieur le Président.
The Honourable Minister. Mr. Speaker, we have some of the most strict measures in the world. Flights to the south were suspended. People need to take tests when they arrive. There are quarantines in hotels. Mr. Speaker, the quarantines are being increasingly monitored. We're doing what we need to do to protect people's health. And I would ask the Conservatives to stop trying to scare Quebecers and Canadians. We are doing our job. The Honourable Member for Avignon-Amitis-Matapédia. Mr. Speaker, we keep repeating, Mr. Speaker, that the best way to avoid issues when you get back from a trip is to simply not travel. But given that the government has implemented mandatory quarantines, it needs to be able to provide the services it promises. The delays on the government's hotline are unacceptable. The government tells people it might take 3 hours. That would be too long in itself, but some people have waited up to 25 hours. 25 hours, Mr. Speaker. Can this government confirm that it will immediately add more telephone operators? The Honourable Minister.
Mr. Speaker, as I've said before in this House, it's important that now Canadians remember more than ever, now is not the time to travel internationally. We have added layers of protection on our border, including the need to be tested upon arrival and to quarantine until those results have arrived. We have added additional operators on the line, and we thank Canadians for their patience when they're booking their hotel rooms.
Le député d'Avignon-Amitis.
The Honourable Member for Avignon-Amitis-Matapédia. Mr. Speaker, I would like to remind the government that we asked for these measures back during the holidays to prevent people from travelling over the holidays and bringing back COVID variants to Quebec. It took 2 months for this to be implemented, and now it's a comedy of errors, not just for travelers, but also for hotels. First of all, the government chose the only hotel in Quebec which was an outbreak site for quarantines. But additionally, it doesn't seem able to tell hotel owners how many travelers they should expect. It's asking hotel owners to implement hygiene measures without giving them the information they need to plan. Will this government at least tell hotels what's going on? The Honourable Minister.
Monsieur le Président.
Mr. Speaker, I would like to remind my friends from the Bloc that we're not waiting for the Bloc in order to make decisions. We've taken action right from the beginning. We've put in place some of the strictest measures in the world. Quarantines when travelers get back, quarantines in specific locations, flights to the south have been suspended, Mr. Speaker, and we are monitoring quarantines more closely. So while the Bloc Québécois makes suggestions, asks questions, and talks a lot, we are taking action. The Honourable Member for Avignon, Amitis-Matane, Matapédia. Mr. Speaker, we thought that mandatory quarantines might discourage people who are thinking of traveling, but in the end, what's really discouraging people is the incompetence of this federal government. It doesn't seem to be able to set up a telephone line for quarantines. It's a little bit like when people and businesses try to call the CRA. It's like when people try to call Service Canada to get help with their EI. We're talking about 3 departments, 3 telephone lines, where it's almost impossible to get through to a human being. And imagine, this is the government that wants to tell Quebec how to manage its health system. Can it just start by properly delivering services? The Honourable Minister. Mr. Speaker, I'd like to thank my colleague for the question, for all her questions. In fact, I would say that the Bloc Québécois is very good at asking questions, but it's not so good at solutions. Here in the government, we have shouldered our responsibilities from the very beginning, whether it comes to suspending flights or quarantines, or whether it comes to collaborating with the government of Quebec. Ultimately, the federal government has been there from the very beginning with its partners from Quebec and elsewhere in Canada.
Member for Calgary Nose Hill.
A Liberal member of Parliament recently tweeted that provincial governments would be criminally negligent if they considered easing COVID restrictions. But the reality is that we're 3 months behind the rest of the developed world in getting vaccines. The public is tiring of restrictions and compliance may become an issue. We know COVID restrictions have caused increased domestic violence, a mental health crisis, and countless business closures, and they can't continue indefinitely. We need hope, leadership, and a plan for safe reopening. How many Canadians must be vaccinated before the federal government starts recommending lifting restrictions?
Honourable Minister.
Well, thank you, Mr. Speaker, and I thank the member for her question. And I would agree with her that public health measures, including restrictions, have been difficult for all Canadians. I'll start there, thanking Canadians for their enormous contributions to the safety and health of their friends, their family, and their community. Mr. Speaker, we are on a good path with vaccination, and as the member knows, we are set to receive well over 600,000 vaccines this week, 400,000 the week after. We know that the end is in sight, Mr. Speaker, but Canadians must continue to protect each other. We'll be there for Canadians and for provinces and territories during these next difficult weeks.
The Honourable Member for Calgary Nose Hill.
That word salad will not restore lost jobs, and it will not reunite families. Enough. The United Kingdom is delivering a plan to reopen their economy as we speak. Not everyone will agree with every element, but they're doing what leaders should be doing, making choices, explaining them, and providing a clear, certain, safe path forward. We've not seen this type of political courage from the Liberals. Why?
The Honourable Minister.
Mr. Speaker, I think the member opposite knows that decisions around which public measures are applied and when lies with the provinces and territories, and we have been there every step of the way to support them in these very difficult decisions, whether they're financial measures to support individuals, businesses, indeed the provinces and territories themselves. We've been there and will continue to be there, Mr. Speaker. I look forward to her ideas about how to move forward together with provinces and territories and Canadians instead of constant questions. Perhaps there's some solutions.
The Honourable Member for Calgary Nose Hill.
Yeah, a national rapid testing program, clear timelines on vaccine delivery, understanding how many vaccinated people need to be in place before restrictions are lifting, clear data that is being used to make decisions, choices around how we're moving forward. These are things that the health minister should be doing, not just blaming the provincial government and saying that it's not her job. We need hope.
We need a clear plan that allows people to make plans for their futures, and we need strategies that I just mentioned. How many Canadians must be vaccinated before the federal government starts recommending lifting restrictions?
Honourable Minister.
Well, thank you, Mr. Speaker. And that's exactly what we have been doing. We've been supporting provinces and territories. In fact, the member mentioned rapid testing, millions upon millions of rapid tests to provinces and territories. And even after that, guidance and support and training and working with the private sector to make sure that no matter where and when Canadians have access to testing, that will help them understand their status. Mr. Speaker, billions of dollars to support individuals and businesses and indeed provinces and territories to take those difficult steps, whether it's to impose restrictions or lift restrictions. Mr. Speaker, we've been there, we'll continue to be there, and we will get through this together.
The Honourable Member for Edmonton Strathcona.
Last week, we learned that President Biden will be contributing $4 billion to COVAX. Meanwhile, Canada is the only G7 country that has accessed vaccines through the COVAX program, a program intended to prevent more people from dying in low and middle income countries and to prevent dangerous variants from developing and affecting everyone, including Canadians. This is an international embarrassment. Can the minister admit that the Liberals are accessing COVAX because of their failures to invest in domestic pharmaceutical research, development, and manufacturing capacity?
The Honourable Minister.
Thank you, Mr. Speaker. And we very much welcome the United States contribution. In fact, Canada was the leading donor. We were the first to donate to COVAX, and we welcome countries all around the world making these contributions. And I would just correct my honourable colleague in that COVAX was intentionally set up to have wealthy countries contribute to COVAX, both to procure vaccines so that it could grow purchasing power, so that it could both subsidize vaccines for low-income countries while working for equitable access. Canada was the second largest contributor to the COVAX AMC, and we are very proud that we have helped set up this historic global mechanism.
The Honourable Member for Vancouver Kingsway.
On August 31st, 2020, the Prime Minister publicly stated that Canada would produce 250,000 COVID vaccine doses per month last November and 2 million doses monthly by the end of last year. But the co-chair of the Federal Vaccine Task Force just revealed that producing vaccines in Canada was never possible before the end of 2021. If domestic vaccine production was never a possibility until the end of this year,
I'm going to interrupt the honourable member. Il y a des problèmes de traduction. There's a translation. Would it be all right if I ask the honourable member to repeat the question?
Certainly, Mr. Speaker.
One moment. We'll just make sure. Is the the translation is back on. I'll let the honourable member for Vancouver Kingsway ask his question.
On August 31st, 2020, the Prime Minister publicly stated that Canada would produce 250,000 COVID vaccine doses per month last November and 2 million doses monthly by the end of last year. But the co-chair of the Federal Vaccine Task Force just revealed that producing vaccines in Canada was never possible before the end of 2021. If domestic vaccine production was never a possibility until the end of this year, why did the Prime Minister mislead Canadians by promising millions of doses a full year earlier?
The Honourable Minister.
Mr. Speaker, I'd like to thank my honourable colleague, a very experienced member of this House. Mr. Speaker, the World Health Organization declared a pandemic on the 11th of March. 12 days after, Mr. Speaker, we announced $192 million to support biomanufacturing in this country. And on the 23rd of April, Mr. Speaker, we announced a further $600 million. So if you add it up, Mr. Speaker, in about 1 month from the time that COVID was declared a pandemic, we had put $800 million available for biomanufacturing in Canada. Mr. Speaker, we have made historic investment to restore biomanufacturing, and we'll continue to do so.
Member for Scarborough Agincourt.
Mr. Speaker, our government is on track to receive a total of 6 million vaccines by the end of March, and this week we will be receiving our single largest Pfizer vaccine shipment to date. While all this is good news, we know that there are a number of populations within Canada that have been disproportionately impacted by the pandemic and are at a higher risk. And so I ask the Honourable Minister of Health, what are we doing to ensure that they are vaccinated in an equitable manner? And at the same time, how do we combat vaccine hesitancy?
Well, Minister.
Well, thank you very much, Mr. Speaker, and I'd like to thank the member for her ongoing work and advocacy for those who are most vulnerable, including seniors. It's been a privilege to work with her on these issues. I will agree with her that there are some folks that are more vulnerable to death from COVID-19 and from contracting COVID-19, and that's why the National Advisory Committee on Immunization has provided advice and guidance to provinces and territories about how best to prioritize vaccines so that it gets to those most in need. But the member is also right that as we begin to see more and more vaccine arrive in Canada, we will have to continue to encourage Canadians to take the vaccination when it is their time. I know Canadians are looking forward to getting vaccinated.
The honourable member for Wellington Halton Hills.
Mr. Speaker, today this House will vote on a motion that calls on the government to officially recognize the genocide against the Uyghur people. Reports indicate that the Prime Minister and Cabinet will abstain from this vote. Will the government uphold democratic norms, respect the will of this House and the terms of the motion, and officially recognize the Uyghur genocide?
The Honourable Minister.
Mr. Speaker, as I have said very many times in the past, we are very preoccupied with the reports that have come out of China with respect to the treatment of Uyghurs. The Conservative Party brought forward a motion. We will vote on that today, and I will not try to anticipate or predict the outcome of that vote.
Honourable member for Wellington Halton Hills.
Mr. Speaker, tomorrow the Prime Minister has a meeting with President Biden. We know that the issue of China will be discussed. Will the Prime Minister raise the issue of the genocide against the Uyghur people in his meeting with President Biden?
Honourable Minister.
Mr. Speaker, I thank my honourable colleague for the question. The Prime Minister and President Biden will discuss a number of issues, some of which are related to international matters and some of which are related to China. I cannot speculate on the specific content of those discussions, but China will certainly be raised.
L'honorable député de Richmond.
The honourable member for Richmond, Arthabaska. Mr. Speaker, last Friday, once again, we got rhetoric and lip service from the Minister of Official Languages. She put on quite a show with her new discussion paper. But a question remains, and it's extremely simple. When will the Minister give us an answer? Will she provide an answer to members of the linguistic minority communities? When will she take action? When will she put forth a bill to modernize the Official Languages Act? The Honourable Minister. Thank you, Mr. Speaker. When we talk about a smokescreen, the Conservatives are experts when it comes to official languages. There is a consensus from Francophone communities that are in favor of the reform, the Conseil du Patronat, many other groups. So I'd like to ask my colleague to ensure that the Leader of the Opposition will join those groups and support our action. The Honourable Member for Richmond Arthabaska. Mr. Speaker, the Minister is just talking. I asked a very simple question, but there have been pan-Canadian consultations underway since 2018. Reports from agencies, from the Senate, from the Commissioner of Official Languages. In 2019, there was a national symposium with over 300 participants. That took place here in Ottawa. A new document, a discussion paper isn't what we need. What we need is legislation with teeth. So I'll repeat my question to the Minister. Can she tell us when she can give us a date? When will the changes be implemented. All we want is a date. The Honourable Minister. Mr. Speaker, it's always been clear that this year is our objective, but the Honourable Member isn't listening to what I'm putting forth. We are a minority government. We need their support to move forward with this. It's time for them to show that they support the discussion document that we put forth. And, of course, my question is, will he ensure that we will have better services for francophones through these changes? The Honourable Member for La Pointe-de-L'Île. Mr. Speaker, there's one language, official language, that's threatened in Canada, and that's French. In Quebec, we've put in place tools to protect it, starting with the Charter of the French language. The problem is that companies under federal jurisdiction are not subject to it. Once again, Ottawa claims that it can do better than Quebec. But the solution is simple. Federal companies must be subject to Bill 101. Why complicate life when we could simplify it? The Honourable Minister. Thank you, Mr. Speaker. It's clear. We know that there has been a decline for French in Quebec and outside of Quebec. We want to protect French. Everyone has a role to play and a job to do outside and inside Quebec. We are acting in good faith. We know that there need to be some changes in the private sector regarding the right to work in French and to be served in French in federally regulated companies will be moving in the right direction. The Honourable Member for La Pointe-de-L'Île. Mr. Speaker, the Bloc Québécois put forth a bill. The Bloc tabled a bill to ensure that companies under federal jurisdiction are subject to the Charter of the French language, as requested by the National Assembly, the Quebec government, and all former premiers of Quebec, including Liberals and PQ premiers. But Quebec's will is stronger. This isn't working with the government. Why is the minister refusing to listen to Quebec speak with one voice? Why is the minister refusing to allow the Charter of the French language to apply to all Quebec workers? The Honourable Minister. Thank you, Mr. Speaker. We agree that we have to protect French and that the official language of Quebec is French. We must ensure that we draw our inspiration from the Charter of the French language for the right to work in French and be served in French in federally regulated companies. I've spoken to 6 former premiers, to several others, to former premiers of New Brunswick as well. There is consensus the federal government must assume its responsibilities. In these circumstances, will the Bloc join its voice with ours, put squabbles aside, and move forward to protect French?
The Honourable Member for Thornhill.
Mr. Speaker, for years this Liberal government has accepted implausible assurances from UNRWA that Canadian dollars are not being used to teach Palestinian children to hate. The minister has been duped once again with proof last week that UNRWA continues to use educational materials that glorifies terrorists and urges children to wage jihad against Israel. Mr. Speaker, when will this government stop making empty promises to investigate and just stop funneling Canadian tax dollars to a corrupt agency that conditions innocent children to hate and terror?
The Honourable Minister.
Thank you, Mr. Speaker. Upon receiving these allegations, I contacted UNRWA, and we have been in touch with UNRWA ever since. Canada takes our support for vulnerable people around the world, including Palestinian refugees, very seriously. And of course, there is no place for hate or incitement to violence. We fund neutrality training, and we are working with UNRWA on this. But most importantly, we recognize that there are 500,000 Palestinian children who rely on UNRWA for their education and for their health care. We will continue to work with UNRWA and with these Palestinian children to ensure that they have access to education and ensure that that education is...
The Honourable Member for Charleswood St. James, Assiniboia Headingley.
Mr. Speaker, on January 27th, I asked if the Prime Minister would suspend funding to the United Nations Relief and Works Agency. given anti-Semitic classroom materials being distributed to Palestinian students. UNRWA claimed this was just all a big mistake and that offensive materials were now replaced with content adhering to UN values. So this government just continued with its funding. New reports show anti-Semitic materials are still being distributed to students. Given this, will the government finally suspend funding to UNRWA and find alternative mechanisms for Palestinian aid?
The Honourable Minister.
Thank you, Mr. Speaker. As I have said, there is absolutely no place for hate or incitement to violence, and Canada is working with our partners in this regard with UNRWA, and we are getting to the bottom of this. That being said, I would ask the honourable member to consider that there are 500,000 Palestinian children who rely on UNRWA for access to education. 500,000 Palestinian children whose hopes and dreams are reliant on having access to education. We are all committed to a peaceful situation between Israel and the West Bank and Gaza and the Palestinian territory.
L'honorable député. The honourable member for Mécantic-l'Érable. Mr. Speaker, the Prime Minister said, and I quote, "Whistleblowers play an extremely important role in pointing out how the government can do better." But he's broken his promise to strengthen existing laws. The Prime Minister helps seems to be more interested in protecting his unethical activities instead of protecting Canadians who are seeking to expose wrongdoing. He's camouflaging his own lack of ethics. Will the Prime Minister stop protecting those and to protect those who serve our country transparently? The Honourable Minister. Our government puts forth policies ethically, with equity. We have to ensure that what wrongdoing is and the steps that can be taken to point it out. It's important to make officials aware of diverging points of view and to provide tools of all kinds. We will continue to promote ethics.
Brome-Missisquoi.
The honourable member for Brome-Missisquoi. Mr. Speaker, for the first time, the government has taken action to strengthen language regarding the language of work in Quebec. And I would like to ask the minister if she can inform the House with respect to what the government will do to protect the French language. The Honourable Minister. I'd like to thank my honourable colleague for her question. French has declined. Inaudible.
Pour protéger et promouvoir le français partout à travers le.
More must be done to protect French across the country. There are new rights being recognized so that people can be served in French and work in French in Quebec and in other areas. The official languages asked must be complied with. We must support bilingualism, and we must give the Act teeth.
Desnate, Mississippi, Churchill River.
Mr. Speaker, the Liberals have introduced legislation based on a political ideology that divides urban and rural Canadians rather than on evidence. Canadians want and deserve to be safe in their homes and their communities. This government should focus on finding solutions to gang crime, an area that both urban and rural municipalities are struggling with. Going after law-abiding Canadians will do nothing to reduce violent crime, Mr. Speaker. Can the minister explain how this new legislation will reduce gun crime and gang activity in my community of Meadow Lake and in all of northern Saskatchewan?
Honourable Minister.
Mr. Speaker, our government promised Canadians that we would strengthen gun control. And of course, the Conservatives have promised the gun lobby
that they'll weaken it. Mr. Speaker, there are three ways in which criminals get their hands on guns. They are smuggled, stolen, or diverted. And through the important and necessary measures of Bill C-21, we are taking strong action to strengthen gun control and to cut off the supply of guns to criminals. We're also introducing measures to remove guns from dangerous situations that could be made deadly by the presence of a firearm. Mr. Speaker, through investments in law enforcement and in our communities, along with the strong new gun regulations and legislation, we are keeping our promise to Canadians to help keep them safe.
The honourable member for Yellowhead.
Government's new gun confiscation bill is overreaching. Not only will the legislation confiscate real firearms from law-abiding citizens, but it'll also prohibit the sale of airsoft guns. One of my constituents owns a small sports shooting store that sells airsoft rifles. His livelihood depends on business from the local airsoft club. Mr. Speaker, why is this government going after airsoft guns instead of criminals with illegal guns?
The Honourable Minister.
Thank you very much, Mr. Speaker. And as I've said, we've promised Canadians that we will strengthen gun control, and we know that the Conservatives have promised the gun lobby they will weaken it. Mr. Speaker, we're also listening not just to those who profit from the sale of these firearms, but also to law enforcement who are tasked with the responsibility of keeping Canadians safe. For over 20 years, the Canadian Association of Chiefs of Police have urged the government to take effective action on replica firearms, including the airsoft devices that the member referenced. And when we published these new regulations, the CACP came out strongly endorsing those measures as necessary and important to keeping Canadians safe. Mr. Speaker, we will keep our promise of taking the action to keep Canadians safe.
The honourable member for Sarnia-Lambton.
Mr. Speaker, I've been asking the Prime Minister to pick up the phone and ask President Biden to keep Line 5 open to save 50,000 jobs. Well, the Prime Minister has a meeting with him tomorrow. Considering the importance of Line 5 to our economy, will the Prime Minister ask President Biden to intervene on this issue?
The Honourable Minister.
Thank you, Mr. Speaker. We take the threat to Canadian energy security very seriously, and Line 5 is vital to Canada's energy security, and I would like to tell my colleague how we appreciate her advocacy on this. But we know that Line 5 is vital to workers, producers, consumers in Canada and in the United States. We have always made the case that this is a vital infrastructure, and we will continue making that case. Merci, Monsieur le Président.
The honourable member for Humber River, Black Creek.
Thank you, Mr. Speaker. I stand today again regarding another tragedy in my riding of Humber River, Black Creek. A 14-year-old girl was struck by a bullet in the head and is fighting for her life from a gun that should never have been on the street. How many more young lives will be ruined before we find a way to say enough is enough? Can the government please elaborate on exactly what are their plans to eliminate these gunfires and the continued guns in our communities?
Honourable Minister.
Mr. Speaker, first of all, let me acknowledge and thank the honourable member from Humber River Black Creek, not only for her question, but for her decades-long advocacy against gun violence. Mr. Speaker, as I've indicated, there are three ways in which criminals get their hands on guns. They're either smuggled, stolen, or diverted. And through this legislation we've introduced last week, we're taking very necessary and strong action to strengthen gun control, to cut off the supply of guns into the hands of criminals. We're also taking steps to remove guns from a dangerous situation. But, Mr. Speaker, we have also, in addition to the legislation, made significant new investments in law enforcement, and most importantly, we're going to invest in communities, including the members' community, together.
The honourable member for Winnipeg Centre.
Mr. Speaker, throughout the pandemic, frontline organizations in Winnipeg Centre and across the country have used additional COVID funding to provide life-saving services for low-income families, unsheltered individuals, and women experiencing violence. But on March 31st, this funding will expire. We are not out of the pandemic, and people continue to need help. Organizations are demanding answers about whether this government plans to continue providing support. Will this government commit to ongoing funding for frontline organizations so they can continue assisting their communities during the pandemic?
Honourable Minister.
Mr. Speaker, we recognize the important work that frontline organizations provide
to support the most vulnerable, especially during the COVID-19 pandemic. That is why very early during the pandemic, we provided an emergency community support fund in the amount of $350 million so that those organizations that are facing a drop in donations and a drop in the number of volunteers can continue the critical work that they engage in every single day to provide goods, services, counseling, and other supports to the most vulnerable members of our community. Thank you, Mr. Speaker.
The Honourable Member for Hastings, Lennox and Addington.
Mr. Speaker, we've heard hundreds of questions in this chamber about vaccines, but nothing on what else the government is doing to find treatments for COVID-19. Do they have a team working night and day creating clinical trials for promising treatments and researching the repurposing of existing drugs for potential use? The New York Times has a tracker listing treatments that have shown promise, for example, the drug ivermectin. What is the government doing to test drugs like this, amongst other research, so these endless lockdowns and detention of people at airports can end now?
The Honourable Minister.
Mr. Speaker, I have to say that I am so proud to be part of a government that has heavily invested in science and research, indeed since 2015, when we took over from the Conservative government that had, in fact, slashed investment in research, slashed investment in science, slashed investment in the Canadian Institute for Health Research. But in fact, because of that prescient investment that we made in 2015 and onwards, we have been supporting our researchers, our scientists, our medical health researchers to not only look at solutions around vaccination, but certainly solutions around treatment. We'll continue, Mr. Speaker, to support science every step of the way.
That's all the time we have for today. C'est tout le temps que nous avons pour des questions et commentaires aujourd'hui. Comme il est 3...
It being 3:08, pursuant to order made on Monday, January 25th, 2021, the House will now proceed to the taking of the deferred recorded division on the amendment to the motion of Mr. Chong relating to the business of supply.
Good. The list of members voting by video conference has now been established for the use by the table. The question is the following. Mr. Chong, seconded by Mr. Genuis, moved that A, in the opinion of the House, the People's Republic of China has engaged in actions consistent with the United Nations General Assembly Resolution 260, commonly known as the Genocide Convention, including detention camps and measures intended to prevent births as it pertains to the Uyghurs and other Turkic Muslims. And B,
given that, one, where possible, it has been the policy of the Government of Canada to act in concert with its allies when it